Just anecdotally, myself and my colleagues are seeing more suicidal patients than we may typically see. There's just a lot of stuff to worry about and a lot of really negative news and a lot of really difficult topics.
Millennials have been called many things, including the most health-conscious generation ever. But now new data calls alcohol, drug misuse, and suicide in the millennial generation a devastating impact. Valley News Team's Rose Itzkovitz has more on the numbers that show these deaths in millennials rising and why experts say it's happening.
The millennial group can be vulnerable to addictions and suicide and depression.
Psychologist Joe Ellison says millennials are already seen as a high-risk group when it comes to drug, alcohol, and suicide deaths.
What we're finding is that it's rising at a rate that's worth talking about.
New data from the nonprofit Trust for America's Health and the foundation Well-Being Trust shows alarming increases around the past decade. Drug-related deaths for 18 to 34-year-olds increasing 108%.
So we're seeing more opioid use. It's just you're more likely to lead to overdose.
Meanwhile, a 69% increase in alcohol-induced deaths and 35% increase in suicide deaths.
Suicide is a complex mental health issue, and there's multiple things happening at one time.
Alcohol or drug abuse.
Dr. Ellison says millennials are becoming higher risk because of the factors at play for their generation.
With millennials and their student loan debt or their inability to pay for health insurance, as well as people who are concerned about some of the larger political issues going on.
And while unemployment here in the FM area is very low, Ellison says underemployment is an issue.
Certainly people could get jobs in the food industry or retail jobs are available in the community, but that's not always what people are trained for.
Social media likely can take its toll as well.
You're much more able to compare yourself to others and much more able to be rejected by others through that more anonymous platform.
Ellison says these numbers highlight what's lacking in our healthcare system.
We can always use more mental health providers. I think you can see that in our community. We are very low on psychiatry.
And experts say parents and friends should always keep an eye out for signs of change.
And that's really changes in talk, behavior, and mood.
In Fargo, Rose Itzkovitz, Valley News Live.
If you or a loved one needs help, a quick 211 call will take you to First Link, or you can call the Suicide Prevention Lifeline at 1-800-273-8255. You can find more resources on our website by just clicking on this story.